sphincter pupil. Sphincter pupil means the constrictor of the iris over here is a sphincter pupil. Okay, that sphincter pupil and the serous muscle which changes the shape of the or convexity of the lens are situated within the eyeball. That means these are the intrinsic muscles over here. These are also smooth muscles over here. Okay, what are smooth muscles? Three extraocular muscles are smooth muscles, and these intraocular muscles are smooth muscles. Rest of all the muscles, the bone recti and superior oblique are skeletal muscles or striatal muscles are voluntary muscles. Okay, understood the difference over here? So we are going to discuss the intraocular muscles in the next class, but for today only the extraocular muscles. Muscles. So obviously the muscles are present. What other structures must be present? The nerves, what? Nerves. Nerves and vessels over here. Vessels means both the arteries and the veins. Okay. And then the glands are lacrimal gland. Any other glands you know? Lacrimal gland. Any other glands you know? Okay. It's outside the artery. Accessory lacrimal glands, so the accessory lacrimal glands are not. So okay, we'll discuss that thing. First of all, the lacrimal gland over here. Any other thing? Fascia bulbar. Sorry. Fascia bulbar. We'll discuss about this a little later. Fascia bulbar. And then followed by orbital fat over here. Why it is an important for this fat? We discuss that a little later. There is a fat which is behind the eyeball over here. That is called the retrobulbar fat or orbital fat over here. Getting it? So far we have seen the eyeball, extraocular muscles, nerves and vessels, lacrimal gland, fascia bulbi over here. Bulbi means belongs to the eyeball over here. Okay, and then fat. So these are the basic contents what we are going to see in the bony orbit over here. Okay. So what we will do? So now let us see what are the bones which are forming the orbit over here. First of all, the roof is formed by
frontal.
You must be knowing about it.
Frontal.
The roof is formed by
Frontal bone. Orbital.
orbital plate of frontal bone. Where is it exactly?
Right.
You already know the orbital plate of the frontal bone. This one you know that very well, right? Orbital plate of the frontal bone. Behind that, there will be one more small bone. What is that bone? Lesser wing of the
Sphenoid.
Okay. So this part is the orbital plate of the frontal bone. Behind that, this small part is the lesser wing of the sphenoid. Where you can see this is the orbital foramen which contains the optic canal over here. Okay. Optic foramen continues with the optic canal over here. By this foramen you can understand this part is the what's that one? Lesser wing of the sphenoid. Okay. This part is the
Orbital plate.
So this forms the roof over here. And coming to the floor. Floor will be formed by what is it?
Zygomatic.
Partly by means of anterolaterally by means of the zygomatic over here, and rest of the part will be formed by
Maxilla.
what's it?
Orbital.
Which part?
Orbital surface.
Orbital surface of the maxilla. By this you can understand. What is this one actually?
Infraorbital.
Then followed by the canal and then followed by the infraorbital foramen. By this you can understand this is the orbital surface of the maxilla over here. Okay. And one more bone which is lying over here, small bone over here. Exactly. What's it? Orbital process of the palatine bone. Which part? Perpendicular plate of the palatine bone over here. Okay. So which I have not drawn over here. Okay. So all these forms. That means anterolaterally the zygomatic bone. In the middle there will be orbital surface of the maxilla, and posteromedially by means of the small bone that is nothing but the orbital process of the perpendicular plate of the palatine bone. So these three bones will be forming the floor of the orbit over here. Okay, now coming to the lateral wall. Lateral wall is formed mainly by over here. What is this?
Zygomatic.
Okay, zygomatic bone in the infrared over here. A small part will be formed in the zygomatic bone. And then behind that, this is the orbital surface of greater wing of the
Acha.
sphenoid. But you remember? Greater wing of the sphenoid. So this is the greater wing of the sphenoid over here. In front of that, this part is the
Lateral.
orbital surface of the greater wing of the sphenoid. The lateral wall is mainly formed by the orbital surface of the greater wing of the sphenoid. Got it on it? Great. So coming to the medial wall is formed, that means medial wall is formed by all the way from front to back. Frontal process of the maxilla, then behind that will be lacrimal bone, and then even behind will be
Ethmoid.
ethmoid bone. What is it? Orbital plate of the labyrinth of the ethmoid bone. Do you know the labyrinth of the ethmoid bone? You know the development. So the orbital plate of the labyrinth of the ethmoid bone. Okay, and then further behind will be formed by
Palatine.
body of the sphenoid. That's why we are getting the lesser ring of the sphenoid over here. So there must be a body of the sphenoid over here. Getting it or not? So the lesser ring will be arising from two roots. One is the upper root and one is the lower root over here. In between that is the optic canal. Do you remember? Right? So this part is the body of the sphenoid. Okay. So these are the bones which form the walls of the orbit over here. Okay. So because this is a bony structure over here, you think that there will be any fibrous structure which will be lining the bony orbit over here. So for example, what is that? So it is a frontal bone over here that will be lined by a fibrous structure. What is the structure termed as? Any bone is lined by a fibrous structure. What is this?
Hasa.
Periosteum. So obviously this is also bony cavity over here. If you see, this will be continuous. The frontal bone will be continuous into the orbit over here. So the frontal bone is covered by the periosteum over here. So obviously this orbit also must be lined by the periosteum, which is also termed as the periorbital fascia. Periorbital fascia. Okay. So this is nothing but the fascia, but actually the periosteum of the orbit over here. Okay. So this periosteum of the orbit will be continuous with the endosteal layer of the dura mater all the way through the optic canal over here. Do you understand? So through the optic canal, there is a vein from the middle cranial fossa into the orbit over here. From the middle cranial fossa. So see, this is the superior orbital fissure over here, and this is the optic foramen over here. Both will be leading into the middle cranial fossa. Is it or not? Do you understand or not? See here. For example, this is the anterior cranial fossa over here, in front of the lesser wing of the sphenoid. And this is the lesser wing of the sphenoid. Okay, just behind the lesser wing of the sphenoid, this area is the middle cranial fossa over here. Okay. So if you see properly over here, this below the lesser wing of the sphenoid is the superior orbital fissure. Are you able to see that? Below the lesser wing of the sphenoid, are you able to see this opening over here? Below the lesser wing of the sphenoid, this opening is the superior orbital fissure. This superior orbital fissure is opening over here. Is it not? This is the superior orbital fissure, this is the inferior orbital fissure. So if this is the superior orbital fissure opening into the middle cranial fossa, so there is a communication between the orbit over here and the middle cranial fossa through two structures over here. One is the superior orbital fissure and one is the optic canal. So this entire aspect, that means the lateral wall on all the other walls will be lined by the periosteum over here, will be continuous with the endosteal layer of the dura mater behind. Do you understand or not? For example, this entire surface, cranial surface is lined by the endosteal layer of the dura mater. So whenever it is reaching the superior orbital fissure, that will be continuous over here with the periosteum of the orbit over here, which is also termed as the periorbital fascia over here. Do you understand? Right? So if there is an endosteal layer, it is continuous with the endosteal layer of the dura mater. What happens to the meningeal layer of the dura mater? Covers the eye bone. Okay, not exactly the eye bone, actually the optic nerve will be covered over here. Okay. So whenever the optic nerve is emerging out through this part over here, optic nerve, how it is emerging over here, actually from which part optic nerve will be evolved? From which part optic nerve will be evolved? For example, this is the diencephalon. Diencephalon means, what are the parts of the diencephalon?
Thalamus, hypothalamus.
Hypothalamus, epithalamus, subthalamus, what will be all the thalamus names over there. Okay. So from the diencephalon, for example, this is the anteroposterior aspect. This is the right side, this is the left side, for example. Imagine a cube in this man. Okay. So in the center of it, the third ventricle over here. From the lateral walls over here, they arises a structure called the, what's it name? So this dilated portion over here is termed as the optic vesicle, future eyeball over here. And this is termed as the optic stalk, future optic nerve over here. Very good. So this diencephalon is lined by the meningeal layers on all the sides. Is it not? Right? So for example, this is the dura mater, the uppermost is the dura mater, which contains two layers. One is the inferior that will go towards the cranium, and this part is the
Meningeal.
layer. So these three layers will be continuous with this optic nerve in this manner. Getting it or not? Right? From above and below also. So the optic nerve is surrounded by all the three meningeal layers over here, but only the meningeal layer of the dura mater, but also by means of the arachnoid matter and also by means of the pia mater over here. What for the pia mater will be traveling along with the optic nerve? The blood vessels. The blood vessels will be carried into the optic nerve through this pia mater over here. Pia mater is mainly for, why pia mater is closely adherent to the brain substance? Because the blood vessels will be going deeper into the brain substance through this pia mater. Okay, rest of the meninges will be outside. Those will be far away from the brain substance, which will be carried down cerebrospinal fluid, and of course there is a protective covering outside of it. Got it? So what are the layers which are carrying along with the optic nerve over here? Meningeal layer of the dura mater, arachnoid mater, pia mater. So do you think the cerebrospinal fluid will be over here or not?
Yes.
Obviously, it will be below the arachnoid mater, subarachnoid space. There will be presence of the cerebrospinal fluid. Got it or not? So these eyeballs will be further more towards the orbit over here, and there will be line over. Okay, arising from the diencephalon and goes into the orbit sections over. Got it or not? So this is the basic structure of the orbit over here. Now let us see the contents of the orbit over here. So first of all, the orbit. So this is, I have already told you, this is the orbit over here. The eyeball will be lying at which part? Anterior third of the, what is this? Orbit over here. And this is the eyeball. So by this you can understand the anterior aspect of the eyeball is even beyond the margins of the orbit over here. Getting it or not? So if you see properly, this is the base of the orbit over here. Even beyond the base of the orbit, the eyeball is protruding forward over here. Getting it or not? So two things you are supposed to understand over here. First of all, this is the eyeball over here. So whenever you pass an axis over here, so within this convexity of the cornea over here, this summit is termed as the anterior pole, and towards this convexity of the sclera over here, this summit is termed as the posterior. What is that? Anterior pole and posterior pole over here. If you pass a line over here, that will be forming the visual axis. Whatever we are seeing, it will be passing in this manner, all the way from the front towards the back onto the retina. Getting it on? If I am looking at you, your image will be captured into the lens and then followed by, first of all the pupil and then followed by the lens and then following into the retina over here in a straight manner over here. Getting it on? So that is the visual axis over here. Okay. And one more thing, if you draw a line over here, dividing the eyeball into anterior half and posterior half over here. So this line will be forming the equator of the eyeball. So this is the visual axis over here, and this is the equator of the eyeball. Just remember these two things which will be useful further later. Okay. So visual axis is this one, and whenever you pass the line over there, that is the equator over here. Okay. So this is about the eyeball. Eyeball we'll discuss in the next class, and let us see all the other structures over here. If there is an eyeball, the movement of the eyeball is done by all the muscles, right? So what are the muscles you know already?
Rectus chapter. Doubly. Smooth muscle. Superior tarsal and supertarsal.
So the muscles of the eyeball will be arising from a ring over here. What is this ring? There is a ring.
Zinc.
Microcartilaginous ring over here. So if you see properly, above the orbital plate of the, orbital surface of the greater wing of the sphenoid is the superior orbital fissure, and below the orbital surface of the greater wing of the sphenoid is the inferior orbital fissure over here. What for these fissures are needed over here?
Not
What's the apex of the orbit? for the passage of the nerves and
Blood
vessels
vessels.
to and fro. Can you know? To and fro. Okay. So what are the nerves and vessels? So basically the muscles will be arising from this tendinous ring over here. Sorry, fibrocartilaginous ring over here or tendinous ring over here. So the four recta will be arising from these tendinous ring. What are the four muscles? The upper one,
Superior,
upper
inferior,
aspect will
medial,
be
rectus.
superior rectus, medial aspect will be medial rectus and then followed by inferior rectus and lateral rectus over here. And the other muscles, other extraocular muscles are, one is the
Oblique.
superior oblique over here. Superior oblique will be arising from the under surface of the what is bone. Under surface of the lesser wing of the spine. Two muscles will be arising from the under surface of the lesser wing of the spine. And one is the superior oblique over here and the other is levator palpebrae superior, which elevates the upper eyelid over here. Okay, so two muscles will be over here. I can't draw the two muscles, but on either side. Okay. Laterally will be the levator palpebrae superioris. Medially will be the superior oblique muscles. So superior oblique muscle, levator palpebrae superioris, and the four recta will be arising from this area over here. From the almost at the apex over here. From the base, only one muscle will be arising over here. What's that muscle?
Orbicularis.
Just lateral to the fossa over here. What's the fossa? Lacrimal
Lacrimal
fossa over here. Okay, lacrimal fossa, which is bounded by anterior lacrimal crest, which is from the maxilla bone over here, and then followed by the posterior lacrimal crest, which is a part of
Lacrimal.
bone over here. In between these two is a lacrimal fossa that will be continuous downwards as the nasolacrimal duct later on, that will be opening into the inferior meatus over here. Okay. So this is the posterior lacrimal crest and this is the anterior lacrimal crest over here. Whenever the periosteum is lining over here, this will be lining in between these two crests and forms the lacrimal fascia over here. Get it or not? Whenever these two crests are present, the periosteum will be coming over here and will be resting, connecting these two crests over here, giving the gap over here. That is nothing but the lacrimal fascia. Sorry, this is nothing but the lacrimal fascia. The space is nothing but the lacrimal fossa over here. The two crests are present in this manner. So this is the lacrimal fascia over here. In between these three is the lacrimal fossa. Getting it right? So just lateral to this lacrimal fascia over here or lacrimal fossa over here is the inferior oblique muscle over here. So only one muscle arises towards the base, that is the inferior oblique. The rest of all the muscles will be arising at the apex of the orbit over here. Getting it right? Understood or not? Right? Don't forget this. So, if you see properly, this tendinous ring is enclosing the intermediate part of the superior orbital fissure and also the optic foramen through which the optic nerve and the ophthalmic artery will be coming from the middle cranial fossa into the orbit over here. Do you understand? By this you can understand through the tendinous ring or through the apex, all the nerves and vessels will be entering into the orbit over here. Okay, let us see what are the vessels and nerves which are entering into the orbit. So this tendinous ring is dividing the superior orbital fissure into three compartments. You already know that. One is the lateral, one is the intermediate, one is the medial compartment. Would somebody tell me what are the nerves which are present over in the lateral compartment? First of all, what are the lacrimal nerve and then frontal nerve and then trochlear nerve. So lacrimal nerve and frontal nerve are the branches of ophthalmic nerve. Okay? Lacrimal nerve and ophthalmic nerve are the branches from
Frontal.
Are the branches from ophthalmic?
Which is a branch?
Okay. So remember this lacrimal nerve, because we have a lacrimal fossa over here. Towards the roof, two important structures over here. There is a depression towards the lateral aspect of the roof, that is the lacrimal fossa which lodges lacrimal gland. Which part of the lacrimal gland? Orbital part of the lacrimal gland. For example, if there is a levator palpebrae superioris in this manner of the upper eye. So this is the upper eye over here, which is the insertion of the levator palpebrae superioris will be into the upper eyelid over here, so that it can elevate the upper eyelid over here. Got it? So if you see that over here, this part will be the orbit. This is the roof of the orbit and this is the upper eyelid over here. So in front of the levator palpebrae superioris towards the lateral aspect, there will be the palpebral part of the lacrimal gland over here, behind the levator clavicular superiors towards the roof there will be orbital part of the lateral gland. Getting it? Palpebral means belongs to the eyelid over here. So inferior of the levator clavicular superiors is the eyelid part over here. Eyelid part, and put the palpebral part of the lateral gland over here. And behind it, just like the submandibular gland, around the mylohyoid muscle, it has superficial and deep parts. The same manner, levator clavicular superiors. So the gland will be in this manner, the lacrimal gland. This is the palpebral part, and this is the orbital part, which is situated at the roof of the orbit over here. Okay. And this periosteum over here will be throwing a projection over here. This projection is termed as
Trochlea.
whatever.
Spine.
Trochlear spine over here. What's that? Not chops of course, but basically trochlear spine over here. To this spine, there will be a pulley over here to hold the superior oblique muscle over here. Got it or not? So this is the trochlear spine or trochlear notch over here. That will be holding the cartilaginous structure over here, microcartilaginous ring over here. That will be acting as a pulley to hold the superior oblique in this line. Superior oblique will be arising over here, and it will take a turn over here and will be inserting into the eyeball over here. Got it or not? Right? So this is the trochlear spine over here. Okay. So because the lacrimal gland is situated over here, for example, the lacrimal gland is situated over here, orbital part. So that will be supplied by this lacrimal nerve over here. Getting it or not? Right? And then followed with the frontal nerve. Frontal nerve will be divided into supraorbital, supratrochlear nerves over here. Okay.
These are
Supraorbital and supratrochlear nerves. Those will be supplying the
Trochlear to
forehead,
medial.
of course, till the scalp, till the vertex over here. Is it or not? The forehead and till the vertex over here, the skin will be supplied by these trochlear and supratrochlear and supraorbital nerves, which are the branches of ophthalmic nerve. Ophthalmic nerve is a branch of trigeminal nerve. Trigeminal nerve generally carries sensations of the face
Facial
over
muscle.
here. Is it or not? So because the sensations are carried from here, these are the nerves which are situated over here. Got it? And then followed by trochlear nerve. Trochlear nerve is the fourth cranial nerve. There is a formula, what is it? SO4, LR6, restful supplied by 3, third number. So this fourth one is this nerve over here.
Superior
So this is the trochlear nerve which will be supplying the
Superior
superior oblique which is emerging over here. Getting it out? And then what are the vessels over here? There is a vessel over here and there is a one more vessel over here. What's that? Come on, somebody. So because it is close to the lacrimal gland, what might be the artery over here?
Lacrimal gland.
Lacrimal artery, but there is a meningeal branch, recurrent meningeal branch of the lacrimal artery. Lacrimal artery is a branch of, can be a branch of? Lacrimal artery can be a branch of?
Internal maxillary.
What? Ophthalmic artery, obviously, because there is an ophthalmic artery which will be emerging. Is it not? So the lacrimal artery is a branch of the ophthalmic artery over here. Okay? So there is one more vein over here towards the medialmost aspect of this. What is that? Superior ophthalmic vein, ophthalmic artery and ophthalmic vein over here. And then these are the branches of the ophthalmic nerve. Everything belongs to the eyeball, that's why ophthalmic over here. Get it? And these are the extra nerves like trochlear nerve, abductor nerve and oculomotor nerve, which will be supplying the other extraocular muscles over here. Got it or not? Basically you are concerned only with the ophthalmic nerve and vessels over here. Apart from this part which will be carrying the branches from the maxillary nerve and maxillary artery over here. Okay, only that is exception. Okay. So this is a superior ophthalmic vein over here. Superior ophthalmic vein will be draining the upper half of the orbit over here. And you know what are the muscles and what are the things which are present. Everything will be drained by superior ophthalmic vein over here. So there is a superior ophthalmic vein, there is an upper part or upper division and lower division, or superior ophthalmic vein and inferior ophthalmic vein. So superior ophthalmic vein will be draining the upper half over here. So that can be finally draining into which part? Cavernous sinus, exactly. Okay. Superior ophthalmic vein, because this is a superior orbital fissure over here. Behind the superior orbital fissure is the middle cranial fossa, which contains on either sides of the body of the sphenoid the cavernous sinuses over here. Okay, sinuses are venous, like channels. The sinuses are the venous channels. The veins will be draining into the sinuses over here. So behind this superior orbital fissure is the cavernous sinus. So superior ophthalmic vein will be draining into the cavernous sinus over here. Okay. The intermediate compartment, what are the nerves over here? Very easy. Third and sixth nerves over here. Okay. Third and sixth nerves
Oculomotor.
Oculomotor nerve. When the oculomotor nerve enters into the orbit, divides into upper ramus and lower ramus. Okay, you know, when the oculomotor nerve enters the orbit, because it has to supply the muscles above and below. Is it all? For example, apart from lateral rectus and superior oblique, the rest of the muscles, like for example, superior rectus, inferior rectus. Superior rectus is above, inferior rectus is below. And inferior oblique is also below. So above it has to supply by means of upper ramus over here or upper division over here, and the lower muscles will be supplied by the lower ramus and lower division over here. So the oculomotor nerve is the majority of the nerve supply over here, divides into upper ramus and lower ramus. Okay. So this is upper ramus and this is the lower ramus and upper division or lower division. What is it? Okay. In between these two, there are other nerves. What is the other nerve over here? Above will be a nerve called the nasociliary nerve. What is it? Nasociliary. This nerve is nothing but the nasociliary nerve, which is a branch of ophthalmic nerve. Exactly. Nasociliary nerve. Okay. And in between these two, above is the nasociliary nerve. In between these two, below will be the abducens nerve over here. Okay. Simple. Third and sixth nerves over here. Third and sixth nerves will be in the intermediate compartment over here. Apart from only one branch from the ophthalmic nerve, that is the nasociliary nerve. Fourth nerve in the lateral compartment, and third and sixth nerves in the intermediate compartment over here. Are you able to remember or not? Because this will be asked in the short notes and the viva also. Can you remember? So, and then coming to the medium-most compartment, that medium-most compartment will be having a main carding.
Inferior
There is
oblique.
a superior ophthalmic vein, there will be
Inferior
inferior ophthalmic vein. Inferior ophthalmic vein is also passing in between the superior orbital fissure and inferior orbital fissure over here. So where it can drain in? So inferior ophthalmic vein can drain into cavernous sinus behind, can also drain into
Pterygoid nerve.
what's the plexus here?
Pterygoid.
Pterygoid venous plexus. If you see properly, this inferior orbital fissure, be able to see this inferior orbital fissure over here? This inferior orbital fissure. This inferior orbital fissure is communicating behind. Communicating ropes out of it. This small
Tenaces.
small ropes out of it. You can refill or something like that. So, see properly everybody, this is the inferior orbital fissure. This inferior orbital fissure is reaching, see properly, this is the inferior orbital fissure. I have kept this paper in the inferior orbital fissure. That is reaching behind towards the pterygoid crossover. Is it not? That means where it is reaching, the inferior orbital fissure is communicating with the infratemporal
Temporal
fossa,
fossa.
and of course there is the fossa over here between the maxilla and the pterygoid process. What is it?
Maxillary fissure. Maxillary.
Maxillary fossa.
Fissure.
No, no, there is maxillary fossa.
Pterygopalatine. Teacher.
Maxillary fissure, but that will be leading into
Pterygopalatine fossa.
The entry point is in between the maxilla and the pterygoid plates over here. But whenever you focus on the fossa, that belongs to in between the palatine bone and
the
the
pterygoid
plates over here. So just behind the maxilla is the palatine bone over here. Even behind is the pterygoid process over here. So in between the palatine bone and the pterygoid process, there is a fossa that is called pterygopalatine fossa. But the entry point is nothing but the
Pterygomaxillary
fissure over here. Okay. So it is communicating with, that means the inferior orbital fissure is communicating with two things over here. One is the infratemporal fossa, and one is the pterygopalatine fossa over here. Okay. So at the level of the pterygoid process, there will be pterygoid venous plexus. That means the inferior ophthalmic vein is draining both into cavernous sinus through the superior orbital fissure and into pterygoid venous plexus through the inferior orbital fissure. Right? So these are the things which are entering into and draining back through the superior orbital fissure. The veins will be collecting the blood back into the whatever the things might be, and the nerves will be entering into the orbit, and arteries also will be entering into the orbit through the superior orbital fissure. Okay. And the nerves and vessels which are entering into the orbit through the inferior orbital fissure are
Infraorbital.
the maxillary nerve branch, infraorbital nerve, and the maxillary artery branch over here,
Infraorbital
infraorbital arteriole. And the vein is nothing but inferior ophthalmic vein. So vessels and nerves are passing through superior orbital fissure and inferior orbital fissure over here. Understood or not? Right? So what we have seen the entry things over here, and let us see the muscle origins and insertions. We have already discussed the
Origins.
origins over here, insertions. insertions you are supposed to understand. So for example, if there is a ring over here, that is nothing but the
Linear reading of
over
thing.
here. So superior rectus will be going above the eyeball. All the recti muscles will be inserted into the eyeball, nothing but the sclera. You know the three cubics of the eyeball or not? The eyeball is made up of three cubics. The outer whitish one is nothing but the
Sclera.
sclera, and the middle one is nothing but the choroid, and the deeper will be the
Which is the
retina. Is it not? Everything will be falling on the retina over here. So the deeper layer is nothing but the retina, and then the middle layer is nothing but the choroid, which is made up of blood vessels mainly, and then the outermost fibrous layer is nothing but the sclera, the whitish part over here. Okay. So into the sclera there will be insertion of all these extraocular muscles. Getting it? 4 recti and 2 obliques. So the recti muscles will be inserted into the sclera in front of the equator or beyond the equator. This is very much important to understand the movements of the eyeball. Just try to remember. All the recti muscles, what are those? Superior rectus in front of the equator over here, just behind the sclerocorneal junction. This is a sclerocorneal junction. Between the sclera and the cornea there is a junction. That junction is called the sclerocorneal junction. So above the sclerocorneal junction and in front of the equator will be the insertions of the recti muscles, only the recti muscles over here. The upper one is the superior rectus over here, and the lower one is the inferior rectus over here, and on either side will be
medial and lateral.
medial rectus and
Lateral.
lateral rectus over here. Okay, medial rectus and lateral rectus. Okay. And how the superior oblique muscles will be coming over here? Superior oblique will be arising over here, and there will be a pulley over here, and that will take a turn. For example, superior oblique is going over here and will be taking a turn over here, and will be inserted onto the posterior aspect of the eyeball over here. Remember, just behind the equator is the obliques over here, and in front of the equator is the recti muscles over here, the insertions over here. Okay. So superior oblique will be going all the way above and takes a turn over the pulley and goes towards the
Posterior.
posterior superior quadrant. See this properly. Anterior superior quadrant, posterior superior quadrant, posterior inferior quadrant, and anterior inferior quadrant of the eyeball over here. Okay. Do you understand or not? For example, this is the eyeball over here. For example, imagine that this is the eyeball over here. This entire skull is the eyeball. For example, now it is the entire eyeball over here. So you can divide in this manner into quadrants over here. So this is lateral quadrants and these are the medial quadrants over here. It is a eyeball, right eyeball over here. So this is the anterior superior quadrant towards the lateral aspect, and this is the posterior superior quadrant towards the posterior aspect. And this is the anterior inferior quadrant, posterior inferior quadrant. Anterior superior quadrant towards the medial aspect, anterior inferior quadrant. Posterior superior quadrant, posterior inferior quadrant. All the recti muscles will be attaching in this manner. The recti muscles, if you see the orbits are obliquely situated. This is the base of the orbit. The medial walls of the orbit are parallel to each other rather than the lateral walls. Is it not? So this is the right orbit and this is the left orbit over here. The medial walls will be parallel to each other. In between these two is the nasal cavity. Right? So the lateral walls are in a right angular position over here. When we join these lateral walls, it will form a 90 degrees angle over here. That means the lateral walls are obliquely situated over here. Okay. So if the eyeball is in this manner, if the eyeball is situated, for example, this is the cornea, and this is the eyeball over here. If this is the cornea, and this is the eyeball over here. On the cornea in the center. Okay. All the muscles are arising obliquely from here and you are attaching over here. Do you understand? The recti muscles are arising obliquely in this manner and will be attaching into the orbit in this manner. That is obliquely directed recti muscles. Do you understand? So this is the orbit, for example, this is the eyeball over here. And this face is the cornea, for example. The superior rectus will be coming all the way from here and will be inserted in this manner. Do you understand? Do you understand? And inferior rectus will be coming all the way from obliquely in this manner and will be inserted over here, in front of the equilibrium. And medial rectus will be coming in this manner and will be inserted over here. And lateral rectus also will be coming and inserted over here. Got it or not? So there will be obliquity of the recti muscles over here. Okay. And what about the obliques? Superior oblique will be coming, of course, obliquely in this manner, and it will take a turn over here and will be inserted into the posterior superior quadrant in this manner. Getting it or not? It is arising all the way from the apex. What is that? Superior oblique will be arising from the apex, but it will be going towards the base and will take a turn over here. Getting it or not? So The superior oblique will be arising from the apex over here and goes towards the pulley, towards the base over here, and will take a turn backwards again and downwards and posteriorly, and will be inserted into the posterior superior quadrant of the eyeball over here. This insertion is very important to understand the movements of the eyeball over here. Okay. Superior oblique will be inserted in this manner over here. So recti muscles are over here and oblique muscles are behind over here. Okay. And inferior oblique will be coming all the way from the base over here, from below, and goes in this manner and will be inserted in this manner. So the obliques will be in this obliquity from the front to back, and the recti muscles are in this obliquity from the back to front. Getting it or not? Oblique muscles will be inserting in this manner, and recti muscles will be inserting in this manner. If I am the eyeball, getting it or not? Oblique muscles will be in this manner, and recti muscles will be in this manner. So let us see the movements of the eyeball based on these muscles. Anybody knows it? How it moves? What are the movements of the eyeball over here? Yeah, exactly. What is it? First of all, let us see the. Will be understood the action of the muscles or not so far? Anybody knows the action of the muscles? Anybody knows the action of the muscles or not? What is it? Okay, generally, first of all, the basic movements of the eyeball are, first of all, this movement. For example, this is the right eyeball and the face is the cornea over here. So this is the nose, which is nothing but the median plane or midline over here. So if the cornea is moving towards the midline over here, that is called the adduction. Any movement towards the body or midline is nothing but the adduction. Away from the midline over here is nothing but the abduction. So this is the central point, central cornea over here. This movement is the adduction. This movement is the abduction over here. So not only that, the cornea will be moving above and below also. So this is called elevation of the eyeball, and this is called the depression of the eyeball over here. Okay. There is one more movement, other movements are torsion. What is the torsion means? In a particular axis, something will be rotating. That is called the torsion. What is the torsion of the testis? Any idea? Torsion of the testis means the spermatic cord will be over here and the testis will be hanging, and if it rotates over here, that is called the torsion of the testis. In the same manner, the eyeball rotates in a particular axis over here, that is called the torsion. So far we have been seeing in the vertical axis there is a movement called adduction and abduction over here. Okay. In a transverse axis there is a movement called
elevation and
depression over here. And there is one more axis, nothing but the anterior posterior axis over here. So how the eyeball can be moved over here? If this is the axis, it can move in this manner and in this manner. So in this manner and in this manner. So whenever, if you put a clock, clockwise for example, clockwise direction, for example, this is the 12 o'clock, this is 6 o'clock, 3 and 9 o'clock over here. Okay. So let us see the movement of the 12 o'clock over here. So there is a term called intorsion. Intorsion over here. So if the 12 o'clock is moving towards the midline, that is called the intorsion. If it is moving away from the midline, that is called the extorsion. Okay, what is that? Intorsion and extorsion. Okay, these are the basic movements of the eyeball. So adduction, abduction, elevation, depression, and intorsion and extorsion. Okay. Why this intorsion and extorsion are needed? For example, if I am looking above, which muscle is acting over here? Superior rectus. Below, inferior rectus. For example, if you are supposed to look obliquely downwards in this manner, so then extorsion and abduction is needed. Do you understand? So there is an extorsion and abduction must be needed to see obliquely downwards laterally. Similarly, intorsion and adduction must be needed to see them medially obliquely over here. Do you understand? So medial rectus, lateral rectus, superior rectus, inferior rectus over here. But intorsion will make you look obliquely downwards or obliquely upwards. Obliquely upwards and obliquely downwards over here. Either laterally or medially over here. So which muscles are producing all these movements? First of all, I'll discuss the obliques so that you can understand the rest of the muscles very easily. Okay. First of all, what are the muscle over here? Superior oblique and inferior oblique muscles over here. Okay, first of all, let us see the superior oblique. Just imagine you are playing a basketball or volleyball. What will you find? How you will throw the ball? Anybody players are there? Exactly. Okay. Any players are there? For example, taking the cricket ball. The cricket ball will be thrown into the air in this manner. In this manner, is it not? In this manner, the cricket ball will be thrown. Or it will be thrown in this manner, right? Let us see. For example, first of all, let us see the superior oblique. So to hit the ball on the ground, you will be applying the force in this manner, right? So let us see the superior oblique. Superior oblique is attached on the contracts, it will move the eyeball in this manner.
Intorsion.
So, for example, you're playing the ball over here, you're trying to hit the ball to the ground over here. Okay. So you're hitting the ground in this manner. So whenever there is an insertion over here, it is turning the ball in this manner and downwards over here. So downward movement of the eyeball is depression over here, and this movement is nothing but one of the torsion. We'll see the torsion. Okay. So this is a superior oblique. It is attaching in this manner. Whenever it contracts, it will pull the eyeball in this manner. Right. So what is this action over here? So
Intorsion.
this is the right eyeball. This is a superior oblique coming and attaching over here. Whenever it is turning the eyeball in this manner, what is this movement termed as?
Intorsion.
Intorsion. So one action is intorsion over here. Whenever it is moving in this manner, it will be pushing the eyeball downwards over here. This action is nothing but
Depression.
depression over here. Is it done? So two actions. One is the intorsion and one is the depression over here. What can be the other action? See here, the muscle is attached towards the posterior aspect of the equator. Whenever it is pulling the eyeball in horizontal direction, in which direction it will move? In which direction it will move? It will move in this manner or in this manner? Laterally. So this action is nothing but, it's not lateral. This action is nothing but abduction. So what are the three actions which will be produced by the superior oblique? One is the intorsion, one is the
Depression.
and one is the
Abduction.
abduction. So these are the three actions of the superior oblique. Exactly opposite to that will be the inferior oblique. For example, inferior oblique is coming all the way from here, from the base, and will be attached over here. So whenever you're throwing the cricket ball into the air over here after catching a catch over here. So how the movement of the ball will be? There will be
Extorsion. Extorsion.
There will be extorsion. Exactly. You are throwing the ball in this manner. So this is the extorsion of the eyeball over here. Okay. And this action is
Elevation.
elevation over here. And how the eyeball will be moved horizontally? Adduction. Okay. Because it is attached over here. How it can move? It will move over here or
No.
over here.
Abduction.
It will move over here or over here.
Abduction.
So for example, so this is the, for example, this is the eyeball, for example. The inferior oblique is coming. Okay, for example, inferior oblique is coming all the way from, for example, this is the left eyeball, for example. The inferior oblique will be coming in this manner. Is it not? Right? So whenever it is pulling horizontally, it will be pulling all the way over here or over here. From posteriorly towards medially. Then which rotation will occur? Abduction will occur. You will understand. Whenever behind the equator the muscle insertions are present, whenever it is pulling horizontally, so the movement of this eyeball will be abduction only, not adduction. Could you understand or not? Could you understand or not? Right? So whenever the muscles are inserted onto the in front of the equator, which movement it can? Either adduction or abduction, based on the direction of the muscles. You will see that. So what are the movements of the superior oblique? Three movements.
Abduction. Intorsion.
Intorsion. One is
Depression.
one is
Abduction.
What are the inferior oblique movements over here?
Elevation. Extorsion. Extorsion. Abduction.
Extorsion, abduction. So in three actions, two muscles. Correct? Cornea we heard. Cornea. Yeah, that is elevation. Generally the cornea elevation or depression. But we will say it as eyeball. Terminology is eyeball only, but the movement will be cornea. Because eyeball is moving over here. Not the elevation means not about elevating in this manner. It's the movement of the eyeball in this manner. Very good. For example, the cornea is-
Temporomandibular joint.
the cornea, if it is moving downwards, is a depression of the cornea. Okay, but basically the terminology is applied to the eyeball. So automatically the cornea will move.
घूमते हैं।
For example, inferior rectus is moving downwards in this manner. Inferior rectus will be attached to this manner, and this will be moving downwards. The eyeball will be in the same position, but the cornea will be moved downwards, rotating downwards. Exactly. It's not about the elevating or depressing. Getting it down to everybody. Okay. It's about the cornea, not the entire eyeball will be elevated or depressed over here. Just to make you understand the movements, I have used the example as throwing the ball above and below. Getting it or not? Eyeball will be in the same constant position, but the cornea will be moved above and below and medially and laterally and into extorsion and intorsion this manner. But it not everybody. Eyeball will be in the same position, but there will be rotations across over here. Getting it or not? So let us see the recti muscles action over here. What's the movement of the recti? Superior rectus will be attaching in this manner. So what action will be produced over here? What's that? What action will be?
Elevation.
First action will be
Elevation.
elevation over here. If it is attaching in this manner, what other movement it can produce?
Adduction.
Intorsion, yeah, exactly. Intorsion, little bit of intorsion. Any other movement?
Adduction.
Because it is attached over here, it will pull the eyeball in this manner, horizontally. So what action?
Adduction.
Adduction will be produced over here. Do you understand now? And now coming to the inferior rectus. Inferior rectus will be attached over here. Exactly opposite actions. What are the actions over here?
Depression.
First of all, depression.
And
then
adduction.
followed by extortion over here. Exactly. And then one more.
Adduction.
Adduction or abduction?
Adduction.
Because it is attached over here, oblique on this manner, it will be pulling it over here. So,
Adduction.
adduction over here. You will understand. Because of the obliquity, the movements will be towards the medial aspect over here. But it not revealing, right? Coming to the lateral rectus, what is the action produced over here? It is attached over here in this manner. Abduction of this. Is it? Abduction. Only
Abduction.
Okay. Coming to the medial rectus,
Adduction.
adduction. Getting it all right? So which muscles are producing elevation and abduction? Which muscles are producing elevation and abduction? Superior rectus and also inferior oblique abduction. Okay, abduction is produced by both by means of inferior oblique and what movements are you asking?
Abduction.
Elevation is done by
Superior rectus.
inferior oblique,
And superior rectus.
inferior oblique and then
Superior rectus.
superior rectus.
Abduction is to
So,
superior or
every
rectus
muscle
portion.
will be associated, that means helped by the other muscles to produce a particular movement over here. Understood or not how the movements are produced over here? Right? So these are the movements of the eyeball by means of the action of all these.
Visually to
Always remember the muscles will be acting obliquely from the posterior to anterior direction. So the movements will be towards medial aspect.
Mana adduction board.
Okay, but the obliques will be towards the other side. Okay, because of the obliquity in this manner. Getting it or not? Until the muscle movements this way. So all these extraocular muscles will be supplied by what the things over here. Superior oblique is supplied by the
Trochlea.
nothing but the trochlea now over here. Lateral rectus is supplied by
Abduction.
abduction now over here, and rest of
Oculomotor.
the other muscles will be supplied by
Oculomotor.
oculomotor, which will be divided into upper ramus and lower ramus and superior ramus and inferior ramus. Okay, that's it. Okay.
Fine,
Now
done.
coming to the other muscles, involuntary muscles, the extraocular muscles, those are.
Smooth muscle. Tarsal.
So what are the other extraocular muscles I told you?
Superior tarsal, inferior tarsal.
So there's a question. So what glands are secreting the tears? Tears over here.
Lacrimal.
Lacrimal glands, any other glands? Axillary lacrimal gland. Lacrimal gland is situated over here and axillary lacrimal gland is situated over. Over where? What is one? This is a conjunctiva over here. So this is the eyelid over here, for example. This is the eyelid with the lashes over here. With the lashes over here. These are the lashes, eyelashes over here. So this is the eyelid, the skin part over here, which is continuous with the conjunctiva, right? So the palpebral conjunctiva, whenever it takes a turn, it is termed as
Right.
fornix. Superior conjunctival fornix over here, and this is the inferior conjunctival fornix. Okay, I'll draw with a different color over here. For example, this is the skin part, and this is the skin part, and rest is the conjunctival part over here. Okay. So this is the eyelid, upper eyelid, and this is the lower eyelid over here. In between the eyeball and the eyelid, this fold of conjunctiva is termed as a superior fornix over here, and this fold is termed as the inferior fornix over here. Lacrimal gland is situated over this roof over here, towards the lateral aspect, but accessory lacrimal glands are situated towards the superior fornix. Multiple accessory lacrimal glands are present towards the superior fornix. These will be secreting the tears in the form of watery secretion or oily secretion. Watery secretion, exactly. What's that? Watery secretion will be done by these lacrimal glands, accessory and main lacrimal gland over here. So if there is a watery secretion, what will be the defect which will be produced over here? If there is only watery secretion over the anterior aspect of the eyeball over here, what problem the patient might face?
Upak.
Only watery secretion.
Upak, how you told
There is a watery secretion over here. For example, you are sweating over here. After some time, what will happen?
Upak.
Dryness. The sweat will be dried off. So the tears also, if it is only watery secretion, that can be easily dried off. If it is getting frequently dried off, what problem the patient will get? Dehydration, no. Small area, no. That is not dehydration.
হ্যাঁ এই তো ডিকশন হবে
Especially the cornea will become dried over here. Whenever there is a movement of the eyelids or because of the air over here, that will undergo
ড্যামেজ
friction. That
বললাম
friction
friction.
leads to rupture of the cornea over here. That leads to scarring of the cornea over here. That leads to loss of vision over here.
ultimately obesity
So when
হচ্ছে
it is only tear production, which is watery secretion, the cornea will become dried off. Later it will be producing the scar that leads to loss of vision over here. So to protect the evaporation of the tears, that means the watery tears over here, what extra thing you can add to preserve the watery secretion of the tear? For example, have you ever seen this news? Like in a particular country, to prevent the evaporation of the water available in the ponds and the rivers, they have added the black colored balls over there on the surface. Have you ever seen that? What for? What for? So if you put some balls, plastic balls on the surface of the water, what will happen?
কী হবে ভাসবে
The evaporation will be reduced over it. Because the sunlight will not be directly hitting on the water. So
আচ্ছা
there will not be
এই
any
থার্মোকলের ইয়ে দেয়
evaporation.
অনেক
In the same
সময় এই জিনিসটা
manner, to prevent the evaporation of the watery tears
Yeah,
over
yeah,
there,
yeah.
if you add an oil supplement on the superficial surface, that will prevent the evaporation of the watery tears over there. Getting it or not? Would you understand? If you add the oil on the surface of these watery tears over here, this will not evaporate. This will protect it over here. It acts as a lubricant also. That oily secretion will be produced by means of a glands called the tarsal glands, which are present in the eyelid over here. The watery secretions will be produced from these
Accessory
lacrimal
lacrimal.
glands over here. But the oily secretion which will be infrared, that means which will be covering this watery secretion, there will be one more oily secretion produced over here. That will be produced by means of glands called the tarsal glands. Tarsal glands. Have you ever heard a term called the superior tarsal plate and inferior tarsal plate or not? Right? The eyelid over here will be having a central core of fibrous tissue over here. That is nothing but the tarsal plate. That tarsal plate in the core contains the tarsal glands, which will be secreting the oily secretions over here on the eyeball over here. So which will prevent the evaporation of this watery tears over here. Getting it out? Right? So these are the tarsal glands, and this is the superior tarsus and this is the inferior tarsus over here. This inferior tarsus also will be having the tarsal glands over here. The two muscles, which are the smooth muscles, will be attached to this tarsal plate over here. So what are the two muscles over here? This is the inferior tarsal muscle and this is the superior tarsal muscle. This superior tarsal muscle is a derivative of the levator palpebrae superioris. That means, for example, levator palpebrae superioris is going and attaching to the skin part over here, and also it will be attached to the anterior surface of the tarsal plate also. Okay. So as a whole, this levator palpebrae superioris will be elevating the eyelid over here, and this muscle is nothing but the superior tarsal muscle, which is derived from the levator palpebrae superioris. See, understand the difference over here. Levator palpebrae superioris is the skeletal muscle, and it is supplied by the levator palpebrae superioris. Whenever it is lying close to the superior rectus muscle, which nerve can supply the levator palpebrae superioris? Oculomotor. The nerve which is close to this muscle can also supply over here. Isn't it not? The facial nerve is supplying over here, not only the facial muscles, but also the posterior region of the digastric over here, because it's closely available over here. In the same manner, the nerve which is supplying the superior rectus muscle over here is also lying close to the levator palpebrae superioris over here. So the same nerve which is supplying the superior rectus also can supply the levator palpebrae superioris over here. So the levator palpebrae superioris, the nerve supply is oculomotor nerve. So all the extraocular muscles are supplied by the oculomotor and other nerves. Okay. So but the derivative of this muscle is nothing but the superior tarsus muscle or superior tarsal muscle, which is a smooth muscle, involuntary muscle over here. So from the voluntary muscle, there is a derivative of involuntary muscle over here. Okay. This is the dollar button. Okay. So whenever there is an involuntary muscle, nothing but a superior tarsal and inferior tarsal muscle over here, which nerve supply can be supplied the smooth muscles. Which system of nerves will be supplying the smooth muscles generally? In case of GIT, which nerve system will be supplying? Sympathetic and parasympathetic. So obviously, the superior tarsal is an involuntary muscle, nothing but the smooth muscle or unstriped muscle. This also nothing but the inferior tarsal muscle, also a smooth muscle. These are supplied by the sympathetic plexus of nerves, especially from the superior cervical ganglia. Getting it or not? Superior cervical ganglia will be supplying the superior tarsal and inferior tarsal muscles. Got it or not? But this inferior tarsal muscle will be joining with the fibrous tissue covering this inferior rectus muscle. What is the fibrous tissue covering these muscles? I'll be covering it later. Okay. First of all, there is a fibrous structure like the fascia covering this inferior rectus over here. This inferior tarsal muscle will be connected to that particular fascia over here. Getting it or not? So this superior tarsal muscle is connected to the levator palpebrae superioris because it's a derivative, and this inferior tarsal will be connected to the inferior rectus. Got it or not, everybody? Right? So these both smooth muscles are supplied by sympathetic plexus of nerves derived from the superior cervical plexus over. Okay. So far we have seen the contents of the orbital eyeball and the muscles and the nerves over here. Right? What is the another important nerve that will be supplying the eyeball or entering into the eyeball over here? That is nothing but the nerve of the eyeball. Apart from all these nerves over here, one important nerve which should be supplying the eyeball or should be carrying the things from the eyeball is nothing but the optic nerve, which should be associated with one more artery that is nothing but ophthalmic artery. Ophthalmic artery will be entering into it over here, into the eyeball over here, and will be dividing into multiple branches. We will discuss in the next class. Okay. So these are the muscles and nerves and vessels of the orbit over here, which are the contents of it. Okay. What are the other things? There is a fat over here. So in between these cone of muscles, there will be fat, which is also called the retrobulbar fat. Not in front of the eyeball, behind the eyeball, there is a fat within this cone of muscles over here. So what for this fat over here is needed? For example, you are moving the eyeball with respect to the muscles over here. Is it not? The muscle will be pulling the eyeball in this manner or in this manner, right? Whenever there is no fat over here, eyeball will be brought back into the posterior aspect of the orbit over here. To prevent this backward dislocation, this fat is needed in the retrobulbar area. Do you understand? That means the fat will be providing the cushion to the eyeball over here and also prevents the posterior dislocation of the eyeball over here. And who will prevent the anterior dislocation of the eyeball?
tarsal plate.
Muscles, exactly, because muscles are holding all the way from here to here. So the eyeball can't be dislocated forward over here. Getting it or not? So the eyeball anterior dislocation will be prevented by this of these muscles over here, and the posterior dislocation will be prevented by this fat over here. Got it or not? So the final thing.
Stay in the class. आप तो भाई है हाँ
कंटिन्यूसली बोले ना सर
हाँ এটা একটা কথা আজকে মাঝে মাঝে রেস্ট দেওয়া দরকার
ट्रेन है मैसिंग है
আজকে ওয়েদারটা পুরো ঘুমের ওয়েদার আছে সেরা ঘুম পাচ্ছে
গরম লাগছে মাঝে মধ্যে যখন
হ্যাঁ।
দৌড়ে আসবে বা হেঁটে আসবে
আমারও প্রচুর ঘুম পাচ্ছে লাস্ট ক্লাসটা কি করবো কে জানে
ভালো হয়েছে আবার
ও অন্যদিন তো এনার্জি থাকে আজকে এনার্জি নেই কোনো। বাড়ি গিয়ে আগে ঘুমোতে শিখবো তারপর যাবো তো আজকে যাবি
কালকে কালকে
অনেকদিন যাইনি বাড়ি
হ্যাঁ ওই তো আগের তো যাই
আগের বার
ঈদের ছয়
ঈদের সময় যখন ছুটি ছিল তুই চলে গেছিস
আমি যাই তো
হ্যাঁ তার খুবই আগে এসছে
তার জন্য আমি সেটা যাই
কী হচ্ছে আর পাচ্ছি না এটা হচ্ছে ফেসিয়া বালবা
See it, everybody? bulbi, which on the posterior aspect will become continuous with exactly meningeal layer of the duramen. Do you understand? Behind the eyeball there is an optic nerve. That optic nerve is surrounded by the meningeal layer of the duramen. That meningeal layer of the duramen continues on around the eyeball by means of the fascia card, fascia bulbi ovary, which is a fibrous structure. What for this fibrous structure is needed? To hold the eyeball in a particular position over here. For example, there is a fracture of the maxilla on one side. The bone has separated on either side in this manner. Even though the eyeball will be resting in the same place. Do you understand? So if the maxilla is present over here in this manner, the maxilla is present over here in this manner, for example. So if the maxilla got separated in this manner, the eyeball will not sink down over here. Okay. So this sinking down is prevented by means of this entire fascia over here. The fascia is termed as the fascia bulbi or Tenon's capsule over here. Okay. The lower part of this fascia is holding the eyeball in this manner. The lower part of this fascia is holding the eyeball in this manner so that it will not sink down. So that's why it is termed as the suspensory ligament of Lockwood. That means the lower part of the fascia bulbi is also termed as the suspensory ligament of Lockwood or suspensory ligament of the eyeball. This is holding the eyeball and preventing the eyeball from sinking down whenever there is a fracture of the maxilla over here. Getting it all right? So that's why it is called the suspensory ligament of Lockwood over here. That is the Tenon's capsule, fascia bulbi, which will be holding the eyeball in this manner. So whatever the movements occurs, it will be occurring within this fascia bulbi. Getting it all right? So within this fascia bulbi, the eyeball will be moving here and there. Getting it all right? So the lateral and medial extension of the same fascia is also termed as the lateral check ligament and medial check ligament over here. Do you understand? Lateral check ligament and medial check ligament. The eyeball can't be more completely rotated backwards. Is it not right? For example, this is a cornea. For example, the medial rectus is pulling the eyeball to some extent only, not entirely backwards. Right? So how the skull is having the check ligaments? What are the check ligaments of the skull over here? Alar ligaments. What is happening over here? The 360 degrees rotation will be prevented. We can't turn 360 degrees backwards because of these ligaments. These are the check ligaments which will prevent the backward rotation of the head over here. In the same manner, these check ligaments will not allow the eyeball to turn completely backwards over here. Even the medial and lateral rectus are acting over here. Right? That's why these are the medial and lateral check ligaments over here. So where does this lateral check ligament will be attached over here? You must be knowing.
Zygomatic.
So there is a tubercle called Whitnall's tubercle. Where it is present? Zygomatic bone towards the lateral wall. It's not lateral wall of the orbit. The zygomatic bone will be handled. Whitnall's tubercle over here. So to that tubercle, this lateral check ligament will be attached over here. And what about this medial check ligament over here?
Lacrimal. Anterior lacrimal crest.
Not exactly. What's this? There is a two crests over here. One is the anterior lacrimal crest and one is the posterior lacrimal crest. To which crest it might be attached to?
Anterior.
Posterior lacrimal crest. The posterior lacrimal crest will be giving attached to this medial check ligament. So you understood the check ligament, what is the function, and this suspense ligament of Lockwood, and this fascia bulbi over here, and the continuous with the meningeal layer of the dura membrane. Okay. And the last but not the least, so whenever there is a abnormal movements of the eyeballs. Okay, for example, if you are looking the cornea, for example, the cornea is situated in this manner. Okay, and this is the visual axis, normal visual axis, all the way from the center of the cornea till the center of the retina over here. Is it not? So that is the visual axis. Whenever the cornea is situated and is directed, for example, if I am looking towards the right side in this manner, this action of both the cornea is termed as the dextroduction. Dextro means right side.
Acha.
Dextroduction. Circumduction in the same manner, dextroduction. When I am looking towards the right side, for example, that is called the dextroduction. For example, if one person is answering the viva more than 100% of the questions, so I will be surprising and I will be looking at that particular person. Is it or not? Is it or not? Have you ever experienced it or not? Not yet.
Dextroduction.
If the person is getting beaten up over here suddenly because of the bad answers over there, which will not happen, of course. So I will be looking towards the left side in this manner. So the corneas are moving, both will be coordinatedly called the
লিভোডাকশন
levoduction. If I'm saying above over here, because I'm not able to answer the Viva, I'm looking at the.
প্রেইং গড
Okay, so obviously the corneas will be moving towards upper aspect, that is called the supraduction. And whenever they are looking downwards, that is called the.
ইন্ট্রোডাকশন ইন্ট্রোডাকশন
So okay, subduction. So dextroduction, levoduction, supraduction, and subduction. So whenever the corneas are moving in this manner, so what is this called? Either this side or this manner.
Abnormal.
That is called the
দিস হ্যাঁ
disjunction, which contains one is the
একটা বন্ধু ছিল ডাইভারজেন্ট কনজেন্টিভা কনভার্জেন্স
There are squint.
ও বাংলা না না আমাদের এখানে হবে না অনেকটা ভালো লাগে না ওই রুমটা ভালো ছিল হেলান দেওয়ার জায়গা ছিল ব্যাগ রাখার জায়গা ছিল
না না গ্রুপ এর মনে হয়
না সুইমিং মেন নিচ্ছে সুইমিং মেন নেয়
So disjunction means abnormal movements of the eyeballs over here. Okay.
Hindi
Abnormal
also.
divergent squint and convergent squint. Have you ever seen the people with one eyeball? What's that? Moved apart from the actual axis. Have you ever seen one? Right. So whenever the cornea are moving away from each other, that is called a divergent squint. Okay. For example, one cornea is in this manner, the other cornea is in this over here. Actually, it must be over here. If it is over here, this is called a divergent
group A.
squint. Whenever the cornea is facing towards each other, for example, when the normal cornea is in this manner and one cornea is facing in this manner. Instead of here, it is in this manner. That is called the
Convergent squint.
Divergent squint and convergent squint. When this squint can happen, which action must be lost to produce this action, abnormality? For example, there is a foot drop, for example, which muscles must be overacting and which muscles must be paralyzed. Because of foot drop.
এক্সটেনশনগুলো ড্রপ হয়েছে সোজা কথা
Foot drop, which ones must be paralyzed?
অ্যান্টিরিয়ার কম্পার্টমেন্টে
The anterior muscles must be paralyzed and the posterior muscles must be overacting.
Overacting.
In the same manner, for example, let us see the what's that? Convergent squint over here. So the movement of the cornea, the overactivity of the cornea, that is the overactivity of one muscle is pulling the cornea towards the midline over here.
Adductory
So what
muscle.
is that movement of the muscle?
অ্যাডাকশন
Adduction is produced by normally
মিডিয়াল রেক্টাস
so the cornea moving towards the midline. What is it?
মিডিয়াল রেক্টাস
Medial rectus. So whenever the medial rectus is overacting, that means which muscle is got paralyzed over here?
Lateral rectus.
So in case of lateral rectus muscle paralysis, there will be convergent squint. So this is a normal eye again. So to produce the divergent squint, which muscle must be paralyzed?
Medial.
Medial rectus must be paralyzed. So the
Lateral
rectus
can
is
overact.
overacting over here to produce the divergent squint. So if there is a squint over here, what problem the patient will face?
এদিকে দেখতে পাবেন
Exactly, double vision.
আরে
Diplopia.
বাহ
For example, this is one eyeball over here, and this is another eyeball over here. But the cornea is situated, for example, in case of divergence, the cornea is situated over here, and this is a normal eyeball. This is a normal, and this is the abnormal eyeball over here. Okay. So the visual axis will be passing all the way for the normal eyeball from the front towards the back over here. Okay. So the image will be formed over here, for example. Okay. But the image which is passing over here will be formed over this part. Do you understand? If the image is forming over here, for example, but this eye which is abnormal over here, the image will be passing in this manner over here. Do you understand? The image is
Meet
passing
coral.
in this manner over here. Actually, the image must be passing in this manner over here, parallel to each other. But because of this abnormality, the image is passing and overlapping over here. That's why you are getting double vision over here. Do you understand? Same thing occurs with the convergent squint also. So the cornea is situated over here, the image will be passing in this manner. So there is an overlap of the image over here. So that's why you will be getting a double vision over here. Understood? Right? So if you are able to manually or voluntarily contract the medial recti to move the cornea towards each other. Is it or not? Somebody try it and tell me how many data are present over here. You move the eyeballs towards each other, that is the cornea towards each other, and and tell me how many pages are present over here.
হচ্ছে না তো
So for today, in the next class we'll discuss the
অ্যাটেন্ডেন্স
হয়তো নেবে